Hi, I'm a host, Marsha Florence, for Just Ask Talk Show. Today's show, ladies and gentlemen, is Physical Therapy Made Easy. Hurry back and join us. Hi, I'm your host, Marsha Florence, with Just Ask Talk Show. Today's show, ladies and gentlemen, is Physical Therapy Made Easy, and we have the co-founder of the Physio Board, Shelly Porter. Good afternoon, Shelly Porter.
Hello. Thank you for having me on the show.
Well, thank you. Now, Shelly, this is a twist for us. A lot of times people call and ask us and just what can we do for physical therapy. And so today we wanted to invite you in to give us an idea or concept about the Physio Board and start off with telling us a little about yourself.
Sure. My name is Dr. Shelly Porter, and I'm a physical therapist. I've been in practice for over 30 years with an emphasis on people who are aging in particular. It's been a passion of mine. Motivating people to keep moving, keep exercising, building their muscles, and a problem that kept arising were people having trouble continuing their physical therapy exercises at home. And when asked why, they said, well, I can't get up and down from the floor and my bed is too soft, so how am I supposed to do these? I wish I had one of these therapy tables at home because they feel so good. And that got me thinking, and that is where the Physio Board concept came from.
Okay. Patients' needs, always. Okay. Now, so as you do your practice with your clients, did they all start to come around when the Physio Board was designed, or are they still saying, you know what, I just got used to doing it a certain way?
No, I've had several people. So what the Physio Board does is it creates an elevated exercise surface. So people place the Physio Board. It's very lightweight. They put it on top of their bed. And so now it's an elevated surface, eliminating that barrier of getting down on the floor to do exercise. So once they started doing that, they were able to be more compliant, consistent with their exercises, and receive those maximum benefits, which is flexibility and strength.
Okay, all right. So that's actually given and is it just the elderly, or is it anyone that can use the Physio Board?
It's it's really anybody, because the Physio Board can also help people who just do not want to get on the floor. And that might be because they have dogs that are just all up in their face while they're trying to exercise. I think people can identify to that. But also people that might have space issues, no floor space to get on the floor. But my main target was for people who are mobility challenged and aging.
Okay, wonderful. So we get a chance to see something today different than we haven't seen before, so thank you for that. But you know what, Shelly, one thing about it is that when people are starting to age, they kind of wait till they get to a certain age and then want to start to exercise. So do you have an age criteria that this device actually is suited for?
Well, the way I approach aging is taking each decade of life and kind of giving people challenges and goals and have them think about how they want to be functioning in the next decade and the decade after that. And the sooner that you start building your lean muscle, maintaining balance, keeping your flexibility, and taking that into the next decade with you, the more enjoyable and functional and independent that next decade's going to be. So it's never too early to start. I encourage people throughout the lifespan to be exercising. It's just how that looks might change as you get older.
Okay, because the younger generation, Gen Z as they call them, they're all in the gym, okay? They're all out jogging and running every day and whatever else they're doing. But when we become a certain age, you're like, I don't feel like that today.
Yeah.
I'm not into
Well,
that.
sometimes they're intimidated to go into a gym. And as in my physical therapy practice and with this company, Physio Board, I'm trying to show that you can exercise at home. You can use your body weight, positions of your body, simple bands, balls, things like that. You can build your strength
That's
in the
good.
comfort of your bedroom, on your bed. Yeah.
Yeah,
So it works really
so
good.
how is stretching done on the Physio Board? Is that a good thing to do on the Physio
Oh,
Board?
it's good. And you can even take typical yoga poses that people might be doing. Maybe people are familiar with child's pose or a spinal twist. So you can do a lot of yoga stretches, also just traditional physical therapy stretches. Like people with back pain pull their knees to their chest or stretch their hamstrings. So there's a lot of interventions that you can do just in the category of stretching on the Physio Board.
Okay, now is it a weight criteria? Do you have it based on weight or size?
Well, the Physio Board that we have, which is our standard board, can hold up to a 325 weight capacity. For individuals that might need a higher weight capacity, we do have a Physio Board Plus, and that can hold up to 500 pounds. So we've taken care of that aspect, and it's all about the board thickness itself and just being on a bed and having that Physio Board Plus option is just making sure that you're getting that rigid, supportive surface that is required to do effective exercise.
So let me ask you this now. This may not be, something somebody would try this. Can you sleep on it?
Well, we've had that question about sleeping on it, and there are federal standards in place for sleep surfaces, and so no, we don't recommend that you sleep on it. But it's interesting that you ask because some people, when they have a back episode of pain, they sleep on the floor. So I could see how that would be very enticing to use it, and you could certainly lay on it on your bed to get comfortable and get out of your back pain. But it's just not recommended to sleep all night on it.
Okay. Well, somebody at home got that
Thank you
question.
for asking that.
Somebody
Yes.
got that question like,
Yeah, I got a phone call regarding that topic a couple weeks ago. So thank you for asking that.
Yeah, and then I'm glad you were able to let us know, there's adjustment in the weight capacity, that there's a even larger size board. So is that larger size board longer or thicker or?
No, the length and the width are the same. It's just a thicker base panel, just so that the board will not deform when placed on a soft bed.
Okay, and that's a special made order?
We have them in stock now. So it's just a little extra click on the website to say, hey, I'd like the Plus version, and we ship it out.
Okay, great. Great. All right, because do you consider yourself as an inventor?
Yes.
Okay. So in the art of inventing things like that, I know that I've read, your story. You and your brother came together, and he's the engineer.
Yes.
You guys actually spent a lot of time together trying to,
We did, yeah. Once the problem's identified, it's like, okay, how are we going to make this? And I had a very specific criteria for him. It had to be lightweight. The Physio Board is only 11.5 pounds because these same individuals who have mobility or aging issues, they also might have some weakness. And so it had to be lightweight. So it's only 11.5 pounds. And the surface area was made such that it mimics a physical therapy treatment table. So the surface area allows for rolling on your side, being on your hands and knees, laying on your back, and it's, covers, and you can do most exercises on it.
Okay. Well, I tell you what, Dr. Shelly Porter, we're going to take a break, and we'll be right back with some physical therapy made easy. We'll be right back.
If you store your guns properly,
I'll feel safer when I'm playing outside.
Safer when walking home.
And I won't have to tell my kids, this isn't a drill.
Never let your gun get into the wrong hands. Always lock it up.
And welcome back. Now, ladies and gentlemen, if you are just not joining us, this is Physical Therapy Made Easy, and we have Dr. Shelly Porter as our guest today to tell us about the Physio Board. Now, some of you are asking, what is it? We can maybe show you some photos so you'll see what it is and ask more questions from Dr. Shelly Porter. So I did want to say something about the weight of it and the storage of it, but let's start off with when someone orders it, okay?
Sure.
What's the ordering process?
Okay, yeah, our website is very easy to navigate. Once you purchase your Physio Board and put in your shipping information, it gets shipped within 5 to 7 days, shows up at your house. It's all in one piece. The packaging is such that you can just pull the box off either end, take it out of its bag, and start to use it. So people can put it on top of their bed. They can store it and move it very easily. It only weighs, like I said, about the weight of an ironing board, so about 11.5 pounds, so it is very easy to handle. We do have an accessory of handles that people can purchase additionally if they're finding it difficult to like grasp the board itself. So we do have that option as well.
Okay.
So you'll see that the Physio Board can be stored behind your bedroom door.
I see.
Yeah.
Okay.
So it just slides nicely there, and when your door's open, you don't even see it. It's just back there until it's time to exercise again the next day.
So you can put it in the closet.
You can put it in the closet.
Okay. Under the bed.
Usually not under the
Okay,
bed.
okay.
Yeah, because it's like long. It's 69 inches long.
Okay.
So it is a little bit much to do that.
okay.
But you just lift it up. You get it out of your storage place, which could be behind the door. You could lean it at the foot of your bed against the wall. And then it's easy to carry and just place on top of any bed surface. It can be put on a twin bed, a full size, queen, king. We just recommend that you place it about 6 inches from the edge of the bed to prevent any type of tipping or rolling off of it inadvertently.
Okay. Good, good. I know this photo here looks like it looks real easy. She just removed it from her storage area or whatever, the closet, and placed it on the bed.
Yes.
Okay.
Yes. And on the bed, you can do a variety of exercises. As I was saying before, it's good for any type of stretching, but also for strength training. So what you can see she's doing there is doing some of the dumbbell presses, which is really great for upper body strength. These are some key exercises that are really important at any age, but especially as you're aging, to keep that upper body strength. So you can push yourself up from the floor if you happen to fall, or you can get up out of a chair. So dumbbell exercises are real easy to do on it.
Okay. Wow. All right.
Here we also have resistive bands. So this is, again, exercising from home. You can go to the gym if you'd like to, but this is a very complimentary thing that you can do on your own in the convenience of your home.
And the privacy of your home.
And the privacy of it, and whatever time of day you feel like you want to exercise, it's there for you. So these are just using resistive bands. We use them for the upper body. You can also put them around your knees, and you can do some different strength training for the hips.
Okay. Okay. Wow. Wow. You know, and just the idea of the demonstration of the lady on the board, when people see this, you know, particular show, they can see how easy and comfortable she looks. Now, is this one of your clients?
Yes, yes. This is a great demonstration of somebody who's been using her Physio Board. So she's been working on her core and can do her plank, and she's up to a hold time of 30 seconds to hold her plank. But you can see how it's not, you know, it sinks a little bit into the bed, which gives it its firm stability so that she can just prop herself in her plank. Her elbows are comfortable because of the padded cushioning that we have on there. And yeah, so this is one of my clients.
I'm looking at the plank.
She's been using her Physio Board and doing her PT exercises. And
Can I ask you, how old is she?
She's 81.
Wow.
81.
All right, ladies and gentlemen, you heard her. And you see the photo there. So
proof.
Don't look at it like I can do that. Wow. She's holding up. I don't think I can hold a plank, Shelly, but I'm going to give it
Well, there's a starting point.
Yeah,
we don't go right to the plank,
You
Marcia.
got that right.
We start someplace else and build up that core, but you could get there, and I'm confident of that.
Okay, well, thank you for encouraging me.
Okay.
I needed that. Okay.
Okay.
Well, these are some wonderful photos, and I'm just enjoying watching your client, and she looks like she knows what she's doing. Yeah.
Well, she's been a client of mine for about 10 years. The people that I started with in their 60s have stayed with me, and now they're in their 80s. And because she was doing this, she can still do it. So this is just showing how she can use, you know, her hands in knee positioning, and the board is comfortable, and she can get into some of those stabilization exercises that are important for a healthy back, but also safety for balance.
That's great. That is great. And very impressive.
It is.
Yeah, so I'm just, you know, I'm in awe, and our viewers will be in awe too. Okay, so why use the Physio Board? Physio Board compared to exercise tables, achieve the benefit of home exercise with the Physio Board. You covered all the bases.
Yes, it's like, you know, why use it? And it just makes exercise accessible. It removes a barrier that people have to do these exercises. And if people don't feel like they're being effective and purposeful, then they're not as motivated to do it. So when they're on their soft bed, you know, it's not great.
Right.
And so they're like, is this even doing anything? But yet the idea of getting up on the floor might not be safe, or it might not be possible. And so allowing this elevated exercise surface, now all of a sudden they're super motivated and feeling the benefits and the purpose to doing their exercises.
And they feel safe on it.
They feel safe
Yeah,
on it.
yeah, they feel safe.
Yeah.
So I know we have this checklist here. Okay, lightweight, no setup required, no setup required, ladies and
Right,
gentlemen.
so it does come all in one piece. It doesn't fold or bend, it just is a single unit, and it's meant to be like that to keep its form and allowing that rigid platform. So comes all in one piece, no setup required,
Now,
right out of the box.
washable, removable fabric. So is it zipped in, something zipped in, you can take that off?
It's not zipped, it's tucked and
Okay.
folded over. So our fabric is water resistant and bacteria resistant. So
Okay.
it cleans really easily, but if needed, you can remove it and launder it and then put it
Okay.
back on.
Okay. I mean, some of these points on the checklist, you know somebody at home is asking. So, okay, ridge bases for maximum support. Okay, made and secured in the USA. Oh, USA, okay.
Yeah,
Wonderful.
we get all of our materials from American companies and it's American made materials. So we're proud of that and we're happy to give business to, we're based in Michigan and we're just happy to support local business as well.
Okay, made and shipped in Michigan.
Yes.
Ah, okay.
Yes.
That's good. That's really good.
Yes.
So I tell you what, we're going to take a break, and ladies and gentlemen, I got a surprise for you when you come back. We'll be right back.
This isn't a workout video. It's about how LLS has helped blood cancer patients like me thrive and how your donation can help countless others. Please give today at LLS.org.
So, ladies and gentlemen, like I said before I left off, I have a surprise for you, which really is not a surprise, but we did ask Dr. Shelly Porter to have a demonstration for us so that, let's not just talk about the Physio Board, but let's see what the Physio Board does. So, without further ado.
Yes, thank you, Marcia.
Okay.
I have invited my mom to join us.
Okay.
This is Mary Porter. She is 86 years old, and she is a daily Physio Board user. I kind of talked to my mom in her late 60s and said, hey, Mom, if you want to continue to be active, she has 26 grandchildren. If you want to be active with that, I think we need to do some strength training. So, yes, we did go to the gym, but more so for daily exercise, we were motivated by Mary, our mom, in making the Physio Board. She was our first Physio Board user. She used our prototype and said, yes, this is good. So what she does here is different of her physical therapy exercises. So she's been in physical therapy for like back issues, knee issues, shoulder issues. So she can basically do any of her physical therapy exercises on any bed. So here, this is a rollaway bed that we have, and it works quite nicely. She's not in danger of tipping. You'll see as she changes her position and works on her side that the board is very stable.
She looks very comfortable.
Yeah.
Miss Mary, are you comfortable?
I'm very comfortable.
Oh, okay. then.
Okay.
Okay. So what are some of the conditions that the Physio Board, can assist in?
Yeah, so my mom's an example of what's called like an orthopedic condition, which is just arthritis, post-surgery, rheumatoid arthritis. There's some orthopedic conditions, just aging, but there's also other conditions that really cause a lot of weakness and pain for individuals, and that might be like Parkinson's or ALS or MS or fibromyalgia. And so those people find a great benefit of just this comfort and stable surface elevated on their bed in which they can no longer get on the floor.
Okay. That's great. That's great. 'Cause you named some very severe conditions that when people, once become of that usage of that condition, they seem to want to just sit, or they like, well, there's no need to exercise, but they
Yes.
still should stretch. And
They need to stretch, and that's what I'm trying to convey with my product and in my practice and coming on your show with you, is putting the work in, just doing some basic moves for flexibility, core stabilization. Some strength has such great carryover into life. So as I was saying, if you're motivated by social outings, travel, You want to get that carry-on into the upper, compartment on the airplane.
Oh, yeah.
Or go and watch your grandkid play softball, or maybe even play catch a little bit. It's like you have to put in some work to build a foundation of strength and flexibility to do that. So maybe exercise isn't fun and exciting, and
but it has a purpose.
It has a purpose,
It has
and
a purpose.
I say it's necessary. It's necessary
Right.
so that you can live life and enjoy the things that you want to, and participate in what you want to, and be independent and active.
And you know what? Most of all, if you're a retiree, why not fit in an exercise routine? A lot of times we like, well, I got to go to work, I got to do this, go to school. But if you're a retiree, I believe that this will be, the perfect thing to do. And, the Physio Board would be excellent in a homes that, you're just sitting around every day, okay? So, ladies and gentlemen,
As you
I
retire.
would encourage you
right.
to do it,
As you
okay?
retire, you want to make your wellness a part-time job.
Right.
So you still have a job even though you've retired, and it's about taking care of your body and staying active and strong, so that life is enjoyable. Like, why did you retire? And the why you retired to do what in retirement translates directly into like a physical exercise routine. So this is, I've been talking a lot about an independent person, but there might also be people with more disabilities, and people in their life are playing a caregiver role. So as a caregiver, this Physio Board is also helpful, because you can have your loved one on a raised, supported, elevated surface so that they can do their exercises under your supervision or assistance, and also be more comfortable for yourself.
Okay, okay.
And you talked about going to a gym too, and there might be someone who has visual impairment, or maybe a neurodivergent person who doesn't like the crowds or the noise, and
This would be perfect.
It's great for them.
Right, this would be perfect. I mean, you do have people that, don't want to be involved in crowds, or, have some type of self-esteem issues with being in crowds, especially in the gym, when they can actually have the Physio Board at home and relax and do it in the comfort of their own home. Yep.
Exactly.
That's great.
Yes.
That's great.
And it doesn't need to be in your main bedroom. It can certainly be in your guest bedroom, or you can create a portable situation so you can be in any room of your house and enjoy the view out your window on such a rollaway bed like I have demonstrated here.
Well, I'm just, at all seeing Miss Mary doing all her exercises, and she looks very comfortable. Are you comfortable, Miss Mary?
Yes.
Are you still comfortable down there, Miss Mary?
I'm very comfortable.
Okay, I'm just checking, ladies and gentlemen.
Yeah.
Just checking. Okay.
So we have a base layer of padding just to prevent what's called strike through, so that you're not feeling that firm, rigid panel under there. And then we overlaid it with some softer foam. So anybody who's pressure sensitive is going to appreciate that second layer of foam. So if you're laying on your side, for example, and your hips are a little bit tender, that tends to happen, you can lay on your side comfortably without this hurting, or maybe your spine has a little curvature to it. So the padding that we use for the Physio Board helps to alleviate pressure sensitivity.
So you guys did your homework when you were designing this.
We did.
Okay.
Yes, I went to my brother and I said, it needs to do this, because I'm treating these same patients and clients in my practice, and they need to be comfortable.
That's true.
If it hurts to just lay down, that's
right.
not.
Or if it
that's
hurts
not
to
gonna
even
feel
get up.
Yes.
So, because when you get up out of the bed and you turn sideways and you go, oh, that's a little much right there early in the morning. Or before you go to bed, there's a little pinched nerve somewhere. And you should exercise either before you go to bed or when you get up in the morning. But the Physio Board gives you more flexibility to feel secure.
Secure, yes. So again, the Physio Board is meant as an exercise surface, not a sleep surface. So you can certainly put it on your bed, do your exercises and stretches, which might give you a better night's sleep, and then remove the Physio Board and go ahead and off to sleep.
Off to sleep. All right.
Yeah.
Well, I tell you what, Shelly Porter, your mom's doing excellent. So someone at home is watching this one.
Yes, so if you've done, she's been
How
my
old is she?
client or patient for like over 15 years. Once I hijacked her in her late 60s and said, hey, Mom, I want your 70s and 80s to look like this, and I think you do too. And she was like, yeah, okay.
Okay.
And she started doing her daily exercises, and she's gone to, musical performance, swim contests, basketball games up and down the bleachers. So those are the things that I want people to think about, like what is it they want to do and what do they need to do as far as an exercise program to carry that over for
That's
enjoying
great.
life.
That is great. That is great. Yep. And I encourage our viewers to, you know, give us a call and let us know they want to get in contact with you. All the information will be in the credit roll, but, you know, she's enjoying herself. She's not straining or anything. The Physio Board looks nice and comfortable, and I felt the padding. I'm really impressed with the padding.
Yes. Yeah, that was something we had some customer feedback, and so we went ahead and added that extra softer foam padding. So that's a recent addition to our Physio Board, which we're very proud of. So yeah, we like to hear what our customers have to say. We have some excellent reviews on our website, people using words like game changer, well worth the investment. And that's how I want people to look at the Physio Board, is hopefully as an investment in their health, their safety, their independence.
That's important. Okay, we do a lot of things daily, especially for our children and stuff, but we never think about what we need to do for ourselves at the end of the day or the beginning of the day. And exercise is one of the key elements, that and drinking water.
Yes.
So they go together.
Well, right, you do have, so she's doing a modified plank right now. So we saw my other friend on the screen doing a full plank. So there's still, every exercise has a modification. So you can do anything to build up to being able to do a full plank. So this is one of the precursors to that.
Okay.
I just wanted to call that out since we were so impressed
Well,
with
look,
the plank on the screen
that's
earlier.
Right. But
so
I can
this
start
is
with
good.
I can start with the modified plank myself.
Yes.
So okay.
Right.
We didn't want to get carried away, Marsha. Okay, but it looks good.
Yes.
And she's handling everything very well. Okay, and the width of it and the length of it is excellent.
Yes, it's 27 inches wide and 69 inches long. So it fits most individuals to be able to roll on their side and stay on it. It's not in danger of tipping over on their bed. You know, it's just the surface area of it forms into the bed and creates that stable platform. So it feels very comfortable.
Okay. Okay. And to me, she just completed her full line of exercise that she does every day.
Yes. She just does more repetitions. Okay. She's just showing us a sampling of it. So she does about 20 minutes of exercise every day on her Physio Board.
All right, and 20 minutes is all it takes.
Yes.
Okay.
Yep,
all right.
You can hit all the major things. You can hit your stretches, you can hit your core, your lower body, and then also your upper body. All in 20 minutes.
I think I got 20 minutes.
Yes.
I believe I got 20 minutes a day.
Yeah,
okay.
so she's going to demonstrate here a nice common stretch that people do for their hamstrings.
Okay.
So just taking a belt or a strap or a resistive band and taking the leg straight up in the air and holding it up there while she feels a nice hamstring stretch. She has very flexible hamstrings.
She really does. Okay.
Because she's been doing it every day.
I believe that.
Yes.
I believe that. Well, Dr. Shelly Porter, will you come back and see us again?
I would love to.
I would love to have you
This is
back.
one of my favorite
and,
topics to talk about.
I
so,
see.
Yeah.
And Miss Mary, you've done a wonderful job down there. You're encouraging me. You don't even know it. But thank you for joining us as well.
Glad to be here.
Thank you. Well, ladies and gentlemen, you know what? This was one of those days that you're seeing something that you might want to try at home. So do look in the credit roll and get the information, or call us at 1-800-323-5336 and find out more about the Physio Board. I'm your host, Marsha Florence, for Just Ask. And what do I always say? If you have a question about a person with a disability or just a general question, don't be afraid to ask. Just ask. Thank you.